Hello guys, welcome to MedicalIas channel. Our today's subject is pathology and we will talk about adaptation today. If you like the video, do comment, like and subscribe to our channel MedicalIas. Adaptations are reversible, functional and structural responses to changes in physiologic states. The causes can be stress or the stimulus caused by pathological changes. There are various types of adaptation. The mainly we will study today are hypertrophy, atrophy, metaplasia and hyperplasia. So here first we will learn about hypertrophy today. The hypertrophy is an increase in the size of cells which results in an increase in size of affected organ. So this picture shows the aortic stenosis. It is the left ventricular cross section of heart showing the aortic stenosis. Here we can see the hypertrophy of the affected organ and we can see the organ is enlarged here. The size is enlarged. So here we can see the altered cardiac configurations in left ventricular hypertrophy without and with dilation. Weaved in transverse heart sections compared with a normal heart. The center one is a normal heart without hypertrophy, and here the pressure hypertrophied hearts. This is the left one. It is due to pressure hypertrophy C, and here we can see the mass have increased and the thickness has also increased. We can see here a thick ventricular wall, and whereas here it is dilated, so here we can see less thick ventricular wall. It has increased mass but has diminished wall thickness, and here we can see the wall is thick compared to this one, and this is with no hypertrophy, a normal heart. So this is also hypertrophy. Is elephantiasis and filariasis. Elephantiasis, here we can see the enlarged leg. This is normal one and this is enlarged one. And elephantiasis is normally due to caused due to obstruction of lymphatic vessels. So it is also example of hypertrophy. We can see the enlarged organ. Here we can see the hypertrophy of myocardium, the normal one and the hypertrophied myocardium. In the hypertrophied one comparatively to the normal one, we can see the fibers are thickened and the nuclei is darker and larger compared to the normal one. Here we can see the differences. So this is the difference between the hypertrophied one and the normal one, the myocardium of heart. The next type of adaptation is atrophy. Atrophy is defined as reduction in size of an organ or tissue due to decrease in cell size and number. Atrophy is reduction in size of an organ and hypertrophy was increase in size of an organ. The types of atrophy include first the physiological and pathological atrophy, the second the general and local atrophy, and third are due to the causes, various causes. The first cause is decrease of function, that is dysfunctional atrophy, and the second due to circulatory changes, chronic ischemia, contracted kidney, due to pressure, that is hydronephrosis and hydrocephalus. And the next is neurotrophic, that is due to loss of innervation, and there is also atrophy of muscles due to poliomyelitis, and the next is due to action of physical and chemical factors, that is radiation, exogenous hormones. The other type of atrophies are loss of endocrine stimulation, aging, and involution of lymphoid organs. So here we can see the atrophy of the brain. The first one is the atrophy of brain and the second one is the normal brain. And here we can see the reduction in the size of the organ. Here we can also see the meninges have been stripped. So the size have been reduced, and here is the normal brain. Here it is the slide of atrophy of thymus, and it is the slide of the patient, woman who had thymoma of mixed lymphocytic and epithelial type resected surgically. And so this is the adjacent fatty tissue, and within the fatty tissue there contains nodules of atrophic thymic tissue, and each nodule consists of central eosinophilic hazes corpuscles. So these are marked with arrows, you can see here. This is hazes corpuscles, and the hazes corpuscles are surrounded by the curve of staining small cells. It is possible to distinguish here the cortex from the medulla. The outermost packed cells is cortex area which is deeply stained, so we can see it easily, and lightly stained cells which are slightly eosinophilic, this is medulla. So it is nearer to Hazes corpuscles. This is the slide of atrophy of testes, and here the first one is the normal slide and the second is the atrophic testis. Normally the cause of atrophy of testes is due to decreased secretion of tropic hormones, and when compared with the normal testes in micrograph A, and this is the second, the atrophic. In this one, the seminiferous tubules of atrophic testis, this is seminiferous tubules, and this of atrophic testis show minimal spermatogenic activity, and the tubular walls are also thickened compared to the normal one. Here you can see the thickened tubular walls, and it is a process called hyalinization where there is a deposition of fibrous tissue. Here the F represents the fibrous tissue. So the this hyaline change is a common end result of atrophy or cell damage, and it is frequently accompanied by fibrosis, and hence due to the deposition of fibrous tissue there is minimal spermatogenic activity. So you can see the seminiferous tubules. These are various examples of atrophy. So this is the slide of brown atrophy of heart. So here we can see with increasing age the yellowish brown pigment. See here you can see the yellowish brown pigment. This is called the lipofuscin, and these are the granules. These lipofuscin granules are residual bodies. That is, they are the remnants of cell organelles and cytoplasmic materials. When the parenchymal cells have atrophied because of increasing age or because due to the presence of wasting disease, the condition of brown atrophy results. So this condition is known as the brown atrophy, where we can see the lipofuscin pigment is present, which has been accumulated here in the cells, you can see. And also the muscle fibers are atrophied and narrow. You see the muscle fibers are atrophied and narrow, and also collection of lipofuscin granules are mainly present at the poles of the nuclei. See, this is the nuclei, and it is present at the poles. See, you can see at the poles. See here, you can see it, the yellowish brown pigment. So this is the brown atrophy of heart. So this is the atrophy of kidney. In the first picture we can see the contracted kidney. It is called granular atrophy because of its granular surface, and the parenchyma is atrophied, and also this type of kidney atrophy is mainly due to lower blood supply to the kidney or loss of nephrons. As we all know, the nephrons are the basic working units of the kidneys. And in the second picture we can see the pathological atrophy. It is mainly due to circular insufficiency, and also we can see the viscerous hypertrophy. As kidney is a paired organ, it works together, and hence the atrophy of this kidney causes the hypertrophy of another one, because the viscerous hypertrophy is mainly the enlargement of an organ because of following failure of another organ. Hence here we can see the failure of one organ which leads to viscerous hypertrophy of another one because of functional relationship between them. Next type of adaptation we will learn about is metaplasia. Metaplasia is a reversible change in which one differentiated cell type is replaced by another cell type. Metaplasia arises on the background of disturbance of proliferation and differentiation of stem cells. First is metaplasia of the epithelium, and next we will learn about metaplasia of connective tissue. There are different causes of metaplasia. First is transformation of the glandular epithelium to squamous, the chronic inflammatory process in the respiratory tract, that is bronchitis in also bronchiectasia in also smokers. It is also due to deficiency of vitamin A. And secondly, it can be due to transformation of squamous epithelium to glandular, that is in Barrett's esophagus. It is the reflex of acid fluid from stomach to esophagus. And third is transformation of glandular epithelium to glandular epithelium of another type, that is enterolization in the stomach and gastric metaplasia in the intestine, that is chronic inflammatory processes. So this slide shows the bronchial epithelium from a man who was a heavy cigarette smoker, and here the normal ciliated mucin secreting columnar epithelium has been replaced by a thick stratified squamous epithelium. And also we can see the surface cells which are tending to keratinize, and also the cells in the basal layer. See here we can see the cells in the basal layer shows marked pleomorphism with large hyperchromatic nuclei. See, you can see the large hyperchromatic nuclei and also large mitotic activity. The mitotic activity has been increased. You can see the large hyperchromatic nuclei. The arrow represents the basal layer and the hyperchromatic nucleus. Here we can see the transformation of the glandular epithelium to squamous. It is a chronic inflammatory processes in the respiratory tract. In case of bronchitis, bronchoectasia, smoking, and also deficiency of vitamin E. Here we can see the glandular metaplasia in Barrett's esophagus. We can see the transformation of squamous epithelium to glandular due to chronic inflammation after the reflex of acidic fluid from stomach to esophagus. It is also a precancerous condition. This is the metaplasia of connective tissue in the lung. We can see the ossification taking place, and we can see the bone marrow elements. See, these are the bone marrow elements, that is ossification has been taking place. So the bone marrow elements have been represented by the arrow. So the next type of adaptation we're gonna learn about is hyperplasia. Hyperplasia is defined as an increase in the number of cells in an organ or tissue in response to a stimulus. Hyperplasia is increase of the quantity of cells, ultrastructures, which usually leads to enlargement of both volume and size. Hyperplasia, the cause can be often hormone-dependent processes, and the types of hyperplasia, the first is physiological. That example can be hormone stimulation by estrogens at pregnancy leads to enlargement of uterus, both owing to hypertrophy and as well as result of hyperplasia. The second example can be increase of mammary glands in adolescent girls and at also pregnancy and lactation. The second type can be compensatory. It is due to partial resection of liver. And third is pathological hypertrophy and hyperplasia. The examples include gigantism, acromegaly, gynecomastia, and glandular endometrial hyperplasia. Here the picture shows the gigantism. It is the condition characterized by excessive growth and height significantly above average, and this is the causes by overproduction of growth hormone in children, and it is a rare disorder resulting from increased levels of growth hormone before the fusion of growth plate, which usually occurs at some point soon after puberty. This increase is mostly often due to abnormal tumor growth on the pituitary gland. The next is acromegaly. Acromegaly should not be confused with gigantism. It is the adult form of disorder characterized by somatic enlargement, specifically in extremities and face. Acromegaly is the same disorder of IGF-1 excess but occurs after growth plate cartilage fuses in adulthood. Gigantism is also due to excessive action of insulin like growth factor 1. But while the epiphyseal growth plates are open during childhood, and acromegaly is when after the growth plate cartilage fuses, that is in adulthood. The glandular endometrial hyperplasia. It is a condition of female reproductive system in which the lining of uterus, that is endometrium, becomes unusually thick because of having too many cells, that is hyperplasia. It can raise the risk of developing endometrial cancer, a type of uterine cancer. It is caused because of absolute or relative increase of estrogens due to disturbance of balance between estrogen and progesterone during menstrual cycles, during menopause, and also polycystic ovary and tumors of the ovary. Other causes also include prolonged treatment by estrogens. And the morphology, we can see the thickening of the endometrium and also increase of number of forms of uterine glands owing to their proliferation. Thanks for watching the video, guys. For the next video, stay tuned to our channel MedicalIas. Please subscribe our channel. If you like the video, please like, comment and share. And also if you have any queries, you're welcome in the comments. Thank you.